Today's tutorial is designed to review the same-day surgery discharge plan workflow. The goal is to demonstrate that by utilizing a variety of available tools, such as voice recognition, canned text, and macros, surgical providers can increase their efficiency, improve their documentation, and fulfill organizational expectations. I will now demonstrate how a surgical provider, in this case, an ENT specialist, utilizing some previously built macros and favorites, is able to efficiently document and discharge a same-day surgical case. In this scenario, before you will see the patient's chart, which is now open in the summary panel. In this scenario, the patient is now in the PACU, has completed the operative case, and I, the ENT specialist, am turning my attention to the first area where, if has not already been optimized, is an opportunity to optimize efficiency. Turning to the patient document, looking for the operative note, by clicking New, I have this saved under Favorites, is an easier find, and this should look familiar. Now, I'm not going to spend time to go through each of these areas, but want to spend particular attention or focus to the procedure description here. If this is a procedure that maybe I do on a routine basis, albeit some minor changes, a template or an auto text could be created to save time and efficiency. In this scenario, I have created one for the procedure I performed today, which was a nasal polypectomy. By utilizing Dragon, which is open already, and you can see here at the top is open, I simply use my voice command, my nasal polypectomy. This drops in a complete operative note, which I am able to then edit or make changes if need be. By clicking on OK, I can complete the rest of this note and then turn my attention to the discharge plan. You'll notice the first field, which routinely we see, is the additional instructions. In this scenario, I'm going to demonstrate that I have created my own specific and specialized discharge instructions for this procedure. I'm also going to include the standard same-day surgery, post-operative, post-anesthesia instructions, which you are familiar with. By opening this free text field, I have created macros for each of these. The first would be I have made detailed instructions regarding what I would like for this patient regarding his surgery today. I've used the command my same day ENT, and this immediately puts in a modified version of our post-anesthesia surgical discharge instructions. I've already indicated the fields that I wish for them to know. These are already at the top. The anesthesia post-care instructions are all highlighted, and my cursor goes immediately to my first required field. In this situation, it's asking me when the patient can return to work or school. I can simply state when, Monday, move to the next field utilizing Dragon, Monday, and at this point it is complete. However, in this situation, I wish to add additional instructions regarding the specific procedure that was performed today. By simply scrolling down to a bit further, placing my cursor here, I have additional instructions which I have created in a macro text as well. These are my discharge nasal polypectomy. This drops in very specific detailed instructions regarding the procedure, what I recommend for dressing, pain, follow-up, and also when to call with questions. In these two short maneuvers, I have placed all of the necessary discharge instructions in the patient's chart, which can be printed by nursing and completed. Next, I'm going to turn my attention to the follow-up. In this case, Dr. Pettinato, who is the patient's primary, is already pre-checked. You may not wish to have them follow up with primary or not is your choice. I've already taken liberty of placing in the follow-up surgical provider, and then turn my attention now to the med reconciliation and prescriptions. In this scenario, opening the prescriptions here on the right, I am able to be seeing initially the patient's listed home medications. However, at this point I would like to add pain medications for this patient. By clicking on New Meds, I have already created some favorites. In this scenario, I'm going to give the patient some Vicodin and some Zofran These have been created for me with the amount, frequency, and dose. They also have specific instructions. For example, if I've opened these up and edit, you'll see here I already have these pre-checked and pre-prescribed for them of when and how to take the medication. Having done this, I move to my next field, which is going to take me and show me these are the prescriptions that I have now created. Clicking on Next, it is going to cross-check against medications they have been given here. I am aware of that. And now I see listed here as the 2 new medications and their home medications. At this point, I will convert, meaning I wish to reconcile the patient's visit medications at the top, listed here, indicated by a small building, this is a hospital, against their home medications as indicated by these small houses. You'll notice at the bottom, these are the 2 prescriptions that I have written. I now have all the patient's medications I can reconcile in front of me. Being an ENT provider, I am not comfortable necessarily with levothyroxine or their atorvastatin and wish their primary to follow up with these. I can simply click on Resume Home Medications and it will resume all home medications. They will need to discuss with their primary regarding these. In the event that I wish to have a particular medication held in light of their recent surgery, for example their Plavix, I certainly could choose in this scenario just to click Resume. I could edit that medication, and here under label instructions I could certainly put do not resume until you see your primary, indicating when they should resume that medication. From here, having completed the med rec, in this situation I'm going to ask them to resume each of these medications as well. You'll notice that the fentanyl, we certainly do not want that and it is not able to be resumed. I have now done and completed the med reconciliation. By submitting this, it is going to compare to the medications here, certainly the ones the patient received in anesthesia. I am aware of this. It's going to ask me to pin this, of which I submit my pin. And then immediately it's going to show me about the medications that I have prescribed. In particular, the hydrocodone and the Zofran. Being a Schedule II narcotic controlled substance, I cannot e-prescribe this. I will be required then to check the second box, which is the printer. Under, however, the Zofran, I could e-scribe this. This is the first box here. If the patient has an indicated pharmacy, in this situation they do, I could certainly go ahead and transmit and print. And what this will do at this point is it will bring up the prescription. It will send it to the RX printer located in the PACU. I can print that prescription out and sign it and place it with the patient's chart. In the event that we e-scribe this, this will go to the local pharmacy for being filled, and the patient can pick the prescription up there. For the sake of this demonstration, I'm going to cancel this, and it brings us back into the patient's discharge plan. From here, the only thing left to do at this time is to file the patient's discharge order. Default is to home, self-care. I simply place the discharge order, which is standard. Having done so, I now submit, placing the pin, and I have completed my discharge instructions, my med reconciliation, and specific same-day surgery instructions. I've completed all of the expectations from me as a provider and given specific instructions to nursing staff for my patient. Having completed this, I am done with the process. This ends the tutorial on review same-day surgery discharge plan and workflow.